Hello, I'm Marisa Brizzi. I'm a clinical pharmacist based out of Cincinnati, Ohio, specialized in HIV care.
And Matthew Herrmann. I'm an infectious disease specialist and primary care provider working here in Los Angeles. And today we're here to talk about CABENUVA. So ask me anything.
Anything?
About CABENUVA.
CABENUVA is for virologically suppressed adults and adolescents with HIV-1 who meet certain requirements. See full indication on screen. It is contraindicated in patients with a previous hypersensitivity reaction to cabotegravir or rilpivirine, and in patients receiving the medications listed here. Please watch the entire video for additional important safety information. Please click the link to view the prescribing information for CABENUVA.
All right, so I guess we can go ahead and get started.
Let's do it.
All right, I'm first. So, when did you first start prescribing CABENUVA?
Wow, it seems like forever now. If I recall, our first prescription went in right after the FDA approval of CABENUVA in 2021. So finally to have a new treatment option for our patients, to offer them something different, to get them off pills, it was just a really exciting time.
You know, I had a very similar experience. I was so excited.
Yeah, what about you?
Yeah, having this new long-acting injectable option every month was, so exciting to be able to have new options. There was a little bit of apprehension at first because, we were so used to dealing with just prescribing medications that were, going to go to a pharmacy, but then this long-acting injectable was, how are we going to do this? We've never dealt with long-acting injectables. It was a little bit intimidating, but, we got started right at the beginning, I think similar to you, and just took a small step forward and decided to, have a champion in our clinic. And I think when I talk with other providers or pharmacists who maybe haven't gotten started with this medication yet, I think a lot of that is still that initial fear of the logistics of how are we going to do this. And I encourage everyone who hasn't gotten started just to try,
Just start with one.
Just one. Keep an eye on that patient. Keep an eye on the clinic processes.
Again, it was apprehensive at the beginning, right? It was a new workflow, it was a new type of treatment. But again, we started with one and we figured it out. We really focused on patient education, explaining the importance to our patient of why they really needed to be on time for these medications or these injections. It more or less became a seamless experience. And here we are today. We have almost about 400 people on CABENUVA. I think you said you had similar numbers, right?
Yeah, similar. We just recently went over 400 as well. So, I think everything you've said I resonate with so much because as a pharmacist, all I do is counsel on what options do we have available.
And how exciting for us to be working in a time where our patients living with HIV right now have options. Well,
it is.
Let's see what's next.
Yes.
Okay. Is CABENUVA worth it? Okay.
All right. Well,
that's a good one.
I wonder what we'll say. Well, yes. The reason we do it is for the patients because to not figure it out, that means the patients don't have access to this option. And just to hear the experiences that patients have had by being on this long-acting injectable therapy has been so important. To be able to be a part of that is amazing. Well, how about we do one more?
Let's do it.
All right. So what does CABENUVA mean to you?
What does CABENUVA mean to me? We all went into healthcare for different reasons. And, I think when we're younger, at least for me, and I wanted to be a doctor, right? I wanted to help people.
Agree with that. As a pharmacist, pharmacists focus a lot on adherence to medications, and you take your medication every day. And sometimes people don't want to take their medications, but to have, something that people are excited about, it's changed the way, our visits have gone. I don't know about you as a provider.
100%.
It's just totally changed the dynamic even of clinic visits, which has been so rewarding to be part of that. Well, thank you for joining us.
And don't forget to check out the other Ask Me Anything videos about CABENUVA.
Warnings and precautions. Hypersensitivity reactions. Serious or severe hypersensitivity reactions, including Stevens-Johnson syndrome, toxic epidermal necrolysis, and drug reaction with eosinophilia and systemic symptoms, or DRESS, have been reported with CABENUVA or its components. Some skin reactions were accompanied by symptoms such as fever. Other skin reactions were associated with organ dysfunctions. Oral lead-in may be administered prior to administration of CABENUVA to help identify patients who may be at risk for a hypersensitivity reaction. If a hypersensitivity reaction is suspected, CABENUVA should be discontinued immediately and the patient should be monitored. Post-injection reactions. In clinical trials, serious post-injection reactions, such as those shown here, were reported in less than 1% of subjects within minutes after the injection of rilpivirine. These events may have been a result of accidental IV administration and began to resolve within a few minutes after the injection. It is important to carefully follow the instructions for use and observe patients for approximately 10 minutes after the injection. If a post-injection reaction occurs, monitor and treat as clinically indicated. Hepatotoxicity. Hepatic adverse events have been reported in patients receiving cabotegravir or rilpivirine with or without pre-existing hepatic disease or identifiable risk factors. Patients with underlying liver disease prior to treatment may be at increased risk with CABENUVA. Hepatic monitoring is recommended and discontinue if hepatotoxicity is suspected. Depressive disorders. Depressive disorders have been reported with CABENUVA or the individual components. Promptly evaluate patients with depressive symptoms. Risk of adverse reactions or loss of virologic response due to drug interactions. Adverse reactions or loss of virologic response due to drug interactions with concomitant use of CABENUVA may occur. Use with caution in combination with drugs with a known risk of torsade de Parme. Long-acting properties and potential associated risks with CABENUVA. Residual cabotegravir and rilpivirine concentrations may remain in the systemic circulation for up to 12 months or longer. Non-adherence to injections could lead to loss of virologic response and development of resistance. It is important to initiate a fully suppressive regimen no later than 1 month after the final injection doses of CABENUVA when dosed once monthly, and no later than 2 months after the final injections of CABENUVA when dosed every 2 months. If virologic failure is suspected, switch the patient to an alternative regimen as soon as possible. Adverse reactions. The most common adverse drug reactions were injection site reactions, pyrexia, fatigue, headache, and those listed here. Drug interactions. For important drug interaction information, refer to the full prescribing information for CABENUVA, Vocabria for oral cabotegravir, and Adurin for oral rilpivirine. It is not recommended to co-administer CABENUVA with other antiretrovirals. Drugs that are strong inducers of UGT1A1 or UGT1A9 are expected to decrease the plasma concentrations of cabotegravir. Drugs that induce or inhibit CYP3A may affect the plasma concentrations of rilpivirine. Use in specific populations. Assess the potential risks of using CABENUVA during conception, pregnancy, and while breastfeeding. Please click the link to view the full prescribing information for CABENUVA.